over 70% of women in Nigeria, they present with cancer that is already in an advanced stage. And at that time, it's more difficult to manage, which is why we need to start talking about cancer, and we need to stop the culture of silence. Now, the truth of the matter is that everybody is at risk. And it's not only women that have breast cancer. Men can also have breast cancer, because many people are not aware of that, but men can also have breast cancer, not only women. And then, you know, when we say risk is the possibility of a person getting a particular condition or a disease. Now, everybody has different risks, and we're going to talk about that today. And please, at the end of church, if you have any questions, we'll be around to take your questions. So, now, a person's risk of getting cancer depends on a combination of all these risk factors. And I'll just go into them briefly. Like, I know we have our primary reason for being in church today, so we're not going to take a lot of your time. The first major risk is age. Now, for women, with an increase in age comes an increased possibility of getting cancer of any type, particularly breast cancer. But the funny thing is that in Nigeria it's different. You know, in the US, in America, or Britain, you know, they start screening women maybe from the age of 40, 45. But in our own setting, in our hospitals here, Lagos and Ife, where I also train, we find out that women with breast cancer, you know, they present earlier, usually between the ages of 30 and 39. And breast cancer in younger women is usually more aggressive than the ones that occur in older women. So age is the most important risk factor. Now, the second risk factor is genes. There are some common genes that have been shown to be associated with breast cancer. Genes is from our genetic makeup. That's what makes us what we are, that we inherited from our parents, either our father's side or our mother's side. For example, I'm sure many of us know the American actress, her name is Angelina Jolie. I think last year or 2 years ago, she revealed that she had to have a double mastectomy. Her mother died from cancer. I think her grandmother, her aunt. So when she tested, they found out she was positive for that gene. And the most common genes that are associated with breast cancer are what we call BRCA1 and BRCA2. Even if we know the singer Beyonce, her father too had to come out to say he has been treated for breast cancer. And so his 2 daughters had to go and get the screening to find out whether they had that, you know, that genetic makeup that predisposes them to breast cancer. So that's another thing that is associated with breast cancer. And usually people that have that gene tend to come down with breast cancer at a younger age. Now, I'm sure you'll be wondering, do they get tested for it in Nigeria? It's not routine and it's very expensive. But, you know, when you see your doctor, depending on your risk factor, they may now say someone should test for it or not, particularly with family history. Now, the next few things I'll say are things that we know commonly. Exercise is very important. For example, the World Health Organization has found out that having about 150 minutes of exercise per week reduces the risk of cancer. So that's about 2.5 hours in a week. Now, I know many people in Lagos particularly are always busy, but it can be as little as walking 20 to 30 minutes a day, brisk walking 20 to 30 minutes a day. It's difficult, but we need to start inculcating this habit. And in some offices, they're also trying to make provision for people to be more physically active. It's very important for our health. Because if you consider it, many of us spend an average of 4 to 6 hours a day in traffic. Am I lying? Like even me, I live in a village in Aja. I come to IKEJA every day. Every day is about 2.5 hours, 2.5 hours, give or take. So, and that's the story for many of us. It's even worse now that the roads are bad and there's construction up and down. So it's very difficult to put in that time. But we need to make it a priority to get some exercise every day. Then another thing, alcohol has been shown to be associated with not only breast cancers, but different kinds of cancers. So, in fact, we recommend no alcohol for people. It's one of the things people should stop to reduce their risk of cancer. And of course, when we say alcohol, we know that it goes hand in hand with what? Alcohol and smoking. Smoking, in fact, with all sorts of cancers. So that one is even a no-no. Breast cancer, cancer of the lungs, cancer of the esophagus, nasal cancer. So that one is even a no-no. And it's not just about smoking, but also avoiding secondhand smoke. Because for many people will not know, being exposed to smoke is even worse than you yourself smoking. So you also have to avoid people that smoke around you, because it also predisposes you to even more risk than the person that is smoking themselves. So we've talked about alcohol. We've talked about smoking. Another important thing is our diet. The key thing I want us to take away with diet is not that we'll say stop this or stop that, but the first thing, we have to minimize taking processed foods. What we used to eat, I'm sure we've heard it over and over again. What we used to eat in times past, our own natural foods are healthy. And that's what they are going back to in developed countries. Now, you will go to America, you see chicken, they'll write free-range chicken, grass-fed, you understand, which is our local chicken. But for them, it's a premium. It's even more expensive, than buying all the other types of chicken. But now we want the orobo, we want the frozen chicken. But I'm telling you, our local chicken is healthier. Now, what are other examples of processed foods? All these things that we eat, like sausage, anything that they've had to process and put in chemicals, they affect our health. For example, I will not say stop eating sausage. Many children like it, but we have to reduce it, I can't say stop everything totally. But it should not be the major part of our diet. It should just be once a while. For example, sausage contains nitrites. They use it to, it's like a preservative. You understand? And it's been shown to be associated with even cancer of the colon, in studies that they have done. So we have to minimize processed food. The important thing is to eat what we cook from scratch. That's the important thing. Eat what we cook from scratch as much as possible, reduce snacks and things like that. And then reduce, all those drinks. Let water be the major drink that we drink. Those things should just be once in a while. And then, of course, we have to be careful about high-fat diets. Like even when we cook our stew, I know in Yoruba land, we love to fry our stew, but we have to stop frying the stew. We have to reduce the amount of oils that we put, in our food to make them more healthy. Then we have to eat more of vegetables. If we're eating our swallow, eba, amala, it should be less of that and then more of the vegetables. In fact, we should try and eat vegetables or fruits every day. So it's like a lifestyle change. We have to watch our diet, and then we also have to teach our children the right kind of diet, because they too, they are coming after us and they are learning from us. Now, we've mentioned genetics before. So the health history of somebody's family is also very important, and we must know. But many times people don't like talking about, things like that happen. We should know if there's a history of cancer in any side of the family, either the paternal or the maternal side, our grandparents, great aunts, because it's important when they are trying to calculate the risk for someone, so that, many times it's not saying, oh, this person will have cancer. No. What it means is just that if there's like a family history, for example, if they say screening for 30 to 39-year-olds, maybe it's every 2 years. For someone that has a family history, you would probably be asked to screen, more frequently than someone that does not have, a family history. And then another thing important in women with regards to breast cancer is age at periods. Usually people that have, that start periods earlier than 12 years, and maybe they also have menopause that goes later, they are at higher risk. Please note, I'm not saying they will have cancer, it's just that their risk score, the possibility is higher. And then if there are any breast changes, it's very important, for someone to look at this and then see a doctor and find out. Now, when it comes to breast cancer, when it even comes to our health, the truth of the matter is that you are your own best advocate for your health. So one thing I want to say here is that please, for any reason you have to see a doctor, don't be afraid to ask questions. Don't don't care to be labeled like the patient that asks too many questions. Nobody can know you like you, and nobody can care for you like yourself. So please, you have to be ready to ask questions from your doctor. You have to trust that you know your own body. And if you have to go to a doctor, you have to be prepared with questions. And then don't be afraid to ask anything. There's no stupid question when you are coming to see a health practitioner. And then another thing, if you ever have to see a doctor, this is not even just about breast cancer. You should be ready to take notes down, because sometimes it helps when you go home and discuss with your husband, or your wife or your children, as the case may be. And when you see a doctor, don't just say, oh, I've heard, and be quiet. There's a tendency to do that in Nigeria. Give feedback. If you didn't understand everything they said, don't be afraid to tell them, I didn't get this. Could you go over this? Or could you explain more about this? It's very, very important. And always remember why you're there. You're there to get help. So don't be shy to ask for help, because people tend to see, oh, the doctor, they don't know everything. Sometimes doctors can miss things. So you always have to, to ask questions about that. Now, for somebody that is worried about breast cancer and you go and see the doctor, what are the questions that we need to ask? The first thing, always ask a doctor, what are the breast cancer screening tests that are recommended for you at your age? And what will you benefit from them? We'll still talk about the tests later. Then also ask them, what are the risks and benefits of this screening? And then you also want to know, are you at higher risk for breast cancer? And if you're at higher risk, what are you supposed to do? How often are you supposed to be screened? And then if they find any problem, what are you supposed to do next? And another thing, for anybody that presents to a doctor for breast cancer screening, you must be examined. There's a tendency when you go to a busy outpatient clinic, like in General Hospital or in Lasut over here, there's a rush. Just say, oh, I think you're fine. Please always make sure that a doctor carries out clinical breast examination on you before finalizing, your treatment, or before giving any recommendations. Now, we've talked about a few of the questions that you need to ask your doctor. Now, some other questions that you need to be aware of when you are seeing a doctor that they will ask you. First of all, they will want to ask whether you have any relatives on your father or mother's side that has had a history of cancer or a history of breast cancer. They would also want to know what age you were when you had your first menstrual period. They will also want to know when was the last period, particularly for mommies that are in menopause. At what age did they stop their periods? And then they will want to know if they have noticed any changes in your breast, how often you exercise, how much alcohol you consume in a week, and then what your diet is like, how often you eat fruits and vegetables. These are the things a doctor will want to know, because, so that we can expect these questions and be prepared so as to get the best from any encounter we have with our healthcare provider. They will also want to know, for those that have breastfed, how long you breastfed, and if you breastfed each of your children. And they want to know if you have already started getting mammograms before. And anytime you go and see a doctor or you're going for a mammogram, they expect that you take the previous mammograms that you have done. Now, what are the warning signs that we have for breast cancer? The most common thing, I'm sure we all have heard, is a lump. But not everybody has a lump. There may also be swelling, warmth, or redness, or darkening of the breast. And then there may be dimpling, like, something is pulling at the skin. In fact, I saw a woman from Australia. She said that was the first sign, that she had. When she raised up her hands, her breast, she just noticed that it was like something was pulling at the breast, very faint. But they now found out that, that it was cancer. And then any itchiness, soreness, pain in the breast must be checked out. So all these things doesn't mean it's cancer, but you have to rule out cancer. For example, for the lumps, 80% of lumps that women have will be shown, not to be cancerous. But the important thing is that we must check it out. And then you have to be also aware of nipple discharge that starts suddenly. A woman that is not breastfeeding and you just notice you start having a nipple discharge, it has to be checked by a doctor. And then any pain in any particular part of the breast that does not go away, it needs to be checked by a doctor. And please, like we've said, men can also have breast cancer, particularly if they've had a family history of cancer. So it needs to be checked out. So, sorry, my boss just entered and she'll soon take over. So now let me just quickly talk about breast self-examination. So we always advise women to do breast self-examination every month and to usually pick the same time of the month. For example, for women that are still having their periods, usually we advise about 5 days after your periods have started. Some people have different school of thought. Some people will say during ovulation, but many women may not be able to calculate their ovulation periods. So usually say 3 to 5 days after the period has started. For women that have already attained menopause, the same thing. Pick the same time, of the week, of the month. It can be maybe the first day of the month, of every month, so that you don't forget, or midway, maybe 15th of every month. And the first thing is that we should look. I know that we are both men and women here, but men, you can also tell our mommies. So you can also remind them. So it's important that all of us here. So the first thing is to look. And what do we look out for? We look out for any dimpling. That's what I've described before. Like, you see like a dimple in the breast, any redness, any bulging or swelling, any rash that was not there before, any discharge, particularly from the nipples. And then sometimes, one nipple may appear different to the other than what it was before. And then when you look, usually look in the mirror, you raise your hands and you do the same thing. You put your hands on your waist and you also look for any differences. Now, after you have done that, you usually lie down. When you lie down, usually use your left hand to examine your right breast and your right hand to examine your left breast. So if you lie down, usually put that hand you are not using behind your head. And then you examine the breast. The important thing is to make sure the breast, you cover the whole surface of the breast. And usually, you can go line by line like this, or like the spokes of a bicycle. But you make sure when you come down again, you overlap where you have examined before so you don't leave out anything. And then you feel for all those things that we have said before. You press deep, and you don't use the tip of your fingers, you use the pads so that it's not painful. And you feel the surface, you press deeply to try and feel the inner tissue, and you try and note, if there's any lump or any change in the breast. Usually, we say 5 days after the period has started because when the breast is undergoing changes towards the menstrual period, there may be, some tissue engorgement, and you may feel some swellings that are not there. So that's why I usually let the period be over before you start breast self-examination. And please, it's applicable for both men and women. So any warmth, any undue warmth in the breast, any lump, any swelling, please, we must report, to our healthcare providers. So after breast self-examination, now what are the other things? We said a breast self-examination should be done every month. Some other tests for diagnosis of breast cancer include a mammogram. That is like an x-ray, of the breast. A mammogram, and usually we advise women from the age of 40. But if there's any abnormality, your healthcare provider may advise you to get one. So from the age of 40, 45. In fact, from the age of 45, it's mandatory that we should do one mammogram every year. And sometimes in younger women, they may ask you to do a breast ultrasound instead of the mammogram because the mammogram, particularly if the tissues are dense, they may not be able to highlight, any differences or, little differences that there may be. So usually for younger women, they'll ask them to do a breast ultrasound. And then there's also what they call a 3D mammogram. These are also done, particularly if they can't delineate, if they can't find anything on the mammogram, but they are suspecting breast cancer, so they may ask the person also to do a 3D mammogram as well. And these are also available in Nigeria. So I'll just say, please, we should not be afraid to go to the doctor. Nobody likes hearing a cancer diagnosis or anything abnormal. But the truth is that early detection is what saves lives. Most women that come to our hospital here already have very advanced cancer that may have spread to the lymph nodes or to other organs. So it's better to catch it early and get rid of it than for it to spread. We need to stay alive for our loved ones, for our children, for our families. So it's very important to get early detection. And it's very important for us to also spread the message to our own network of people so that, you know, you're not just sitting there with the information you have, but you're making sure that people around you are also doing the right thing. Now, another thing, if you think the doctor is not listening to you, don't be afraid to change your doctor. If you feel rushed or they don't listen, you understand, pay attention to what you're saying, or they're just brushing it aside, then it's time to look for a new doctor that is ready to listen to you. Now, I know one question will ask, where can you get screened? For example, you can get screened at Lagos State University Teaching Hospital, and the Department of Community Health that I'm a part of. We also have a women's wellness clinic in Rauf Aregbesola Comprehensive Health Center. That's near Gowon Estate. So there's a women's wellness clinic so that you don't have to first waste time in the outpatient. So they do, you know, cancer screening, cervical cancer. They can do a clinical breast exam for you. And the price is very, very minimal. And then you also have Lily's Women's Health. I think they're in Alausa, Cathy Street. They also focus on women's wellness. And then all the teaching hospitals, Lasut, Lut, you can do a mammogram there. They also do mammograms at General Hospital, Bagada, and Isolo, because Total Nigeria donated mammogram machines to those places. So you can do there. And then there are other places that are private. I'm not really aware of the costs, like Lakeshore Center, Optimal Cancer Care Foundation, Renaissance Medical Center. You can also get a mammogram done there. And then all the popular diagnostic centers, such as Micure, clinics, Foremost Radiology, they also perform mammograms. I'm not affiliated to any of this, so this is just for our information. So you can also get a mammogram done in those places. So please, we should not be afraid to get screened. We should get used to doing a breast self-examination every month. And the purpose is that so you know your breast. When you are familiar with your breast, then it's easy for you to detect when you think that there's any change. And it's better to know early so that whatever it is can be addressed immediately. And then we also need to teach our children, particularly our daughters as they are growing up, from the age of 18, so that they too will start doing breast self-examination, you know, for themselves. And then right now, I think, you know, it's Breast Cancer Awareness Month. So I think there is a program where they're doing mammograms at Ogudu Road. I will drop the information with Auntie there. I will drop the information. I think they are doing mammogram for 5,000 and a scan, breast ultrasound for 3,000. And I know mammogram is usually a lot more expensive than that. Some places up to 30, you know, 40,000. And it's on till the end of October. So I'll drop the phone number of those people there so that we can avail ourselves, you know, of the free opportunity. Thank you very much. Now I'd like to invite Dr. Olayinka Goodman.
Praise the Lord. I'm sure we have some questions to. I heard somebody would like to ask a question. I mean, if you like to write your questions also, please, you can write your questions. And after that, we'll also bring Dr. Goodman to speak for a few minutes, maybe like 5 minutes. Okay, because what she said, maybe they will want her to respond. Okay, let's have Dr. Goodman. Dr. Olayinka Goodman, you are welcome. Thank you very much, Dr. Adebayo. Please, let's have Brother Olabi. Yes, please let them write down their question. But Brother Olabi would like to.
Good afternoon. Is it morning or afternoon? Good morning, everybody. I'm sorry the rain disturbed and we had to travel. Most of us are not based in IKEJA. Neither are we based in Wemabod. We came all the way from very far places. So we're glad to be here. And I'm glad that for churches, there are some issues that we need to take serious, that we're taking serious. So I'll just glance through prostate cancer because we have men here. For sake of simplicity, I like to describe cancer this way because for most people, when they hear about the word cancer, I don't know what goes through our minds. We have so many things going through our minds. But the way I like to describe cancer to lay people is a cancer is just an abnormal cell. In other words, to lay people, a cell that has gone haywire. Let me put it that way. So it's the same, a cell that has gone wayward. When you see a child, it's uncontrollable. So that's the way I would like to describe it. And so it means we can have cancer really in any part of the body. Eyes, tongue, anywhere, name it. You just have one cell that has refused to be under control. That is all. So that is the word cancer. Fine. So because this is cancer, I'm trying to lay it down from the word cancer. So because this is cancer, it means that this cell has refused not to be under control. Usually, you may have a swelling. But it's only very obvious for us to notice swelling if it's occurring on our skin, in parts of the body that you can see. But we also know that we have a lot of other organs and tissues that we cannot see, that our eyes cannot see, that are internal. So it means you could have those swelling occur there, and it will be difficult for us to see those things because we are not viewing those things from day to day. So prostate cancer is a cancer, which means an abnormal growth that takes place in the prostate. Funny enough, yesterday I was trying to glance through this thing, and my husband was editing a book for someone. And I was just trying to go through, well, I didn't know we would have some form of multimedia here. Coincidentally, that was what he was looking at. I now told him, I said, oh, do you still remember your biology? So the prostate, because I know to the layman, I talk to people or even my mom, and she will tell me, what's up in your prostate? The truth is, every man, every boy has a prostate. It's just like saying somebody has breast cancer. You're saying, well, no, only breast. Everybody has a breast now. So when you have prostate cancer, it's not as if it's an additional something. Ab initio, once you are born, you have a prostate. So that prostate is just a little small gland. It's actually very little. It's like the size of a walnut, a sala, something as small as that. And it's just at the base of the bladder. The bladder is where you store your urine. So really, this prostate gland is there, and it's supposed to help in the secretion of seminal fluid for transportation of the sperm. But ordinarily, like I described, it is very small. And because it is very small, ideally, you shouldn't even feel this. But due to the abnormal growth that I said, and the truth is, I started from the word cancer. So once a cell goes out of control, the problem is only with that cell. That's the truth. But this cell, because it is out of control, it is growing anyhow. It can multiply itself, meaning that one cell is the only cell that is abnormal. That cell now begins to grow. The rate at which it's growing is not the normal rate at which it will be growing. The implication of this is this. The growth is more, one. Two, it will need more nutrients because the cells there are now more than the cells that should be there. Three, it will need more blood supply. Now, because it's bigger, it may occupy, it's bigger, so it's occupying more space. So most of the time, depending on where this cancer is located, the symptoms may vary. And because of the place where the prostate gland is, the kind of symptoms you will begin to, a person may begin to manifest or experience are signs that will have to do with pressure. One, what are the things that you would see? You may begin to see things like, one, have you ever seen a small boy try to urinate? And I know if you go to primary school, you see many young boys, age 5, 6, 7, when they want to urinate, they will do competition. Let us see whose urine will go the highest. I don't know whether you get what I'm trying to say. And you see that thing, it goes. But the older you go, the truth is you cannot maintain that stream again. Are you with me? So, one, a person will begin to notice that the stream of urine is actually poor. I'm not talking of that gradual reduction. You can't have that thing go as far as that. It's not going to happen. A man may begin to experience poor stream of urine, one. Two, instead of the urine to flow, normally like it will flow a little, then you pause. You can't have it at a stretch, unlike the way, oh, I want to wee, let me get there and just wee. You understand the kind of thing we're saying? You would have that. Other things that we may also observe is that you notice what we call urgency. You feel a need. Oh, I want to urinate, I want to urinate. But before you actually get to the toilet, this has nothing to do with a man is old or a man is not old. The person might actually have peed on himself. Because before you get there, you can't hold that thing. You can't control. It's not causing your bladder to behave normally the way it would have behaved. So that kind of a person may wee on himself. Then we also have other things. Dribbling. After you have finished urinating, instead of, you have urinated, men could be funny. I had one man, a colleague of mine, he pasted on his status at one time, at his WhatsApp. For men, it's not as straightforward as it is for women. So that's why, whether you see boxers and all that, you usually see urine drips on it. Because many times that thing is not going to come out and it comes out all at once. But for dribbling, rather than the thing to come out, it comes, it stops, it comes. Even after you are finished, it's as if that thing continues to dribble. It doesn't just stop like that. That is what a person may also experience. Other things, there could be painful urination when a person is urinating. These are usually the kind of symptoms. Well, there are a lot of other symptoms that may be experienced. But the truth is, before a person begins to experience this, it may take some time. So the implication is a man may have prostate cancer, but yet it does not manifest any symptom. Hello? So the implication of this is that usually what we would recommend, because for over time it's been noticed, when people have prostate cancer, there are things that have to do with age. So usually from age 50, you'll begin to see such things, and it's been found is more in black people than you will see in white people. Then for people that also have a family history, specifically prostate cancer, but even if it's not prostate cancer, if there's a family history of cancer in the family, you need to check yourself. But really, these are preventable things. You do not need to have all of these symptoms. Usually, we would recommend that from the age of 50, you have a PSA done. These are things that can be done. It's just a blood specimen that is taken and it would be checked. So a person can have that. And if this kind of cancer is detected early enough, there are things that it's treatable. The prognosis is by far better compared to someone in which it was detected late. So there are 1,001 other symptoms that other people may experience. Weight loss. But usually the truth is, before you start seeing weight loss in somebody that has prostate cancer, it has really advanced. That's the truth. And for a lot of this cancer, that is why I started with the word, they are uncontrollable. It's just a wayward cell. And that singular wayward cell, the plan is to take over the whole of your body, to take over everything. I want to be in control. More or less, that is what the cell is trying to tell you. I don't know whether you are with me. So it means that if the cell is trying to be in control, that cancer is just in that particular place. But over time, remember what I said, because the cells are more, they need more blood supply, they need more. Over time, you begin to see little cell. That is a cell, but that cell is multiplying. The blood vessels and all that will begin to carry some parts of that cells, and they begin to carry it to other parts of the body. So that's when we begin to say the cancer has spread. So a cancer may be located somewhere. For instance, very bad ones, cancer of the liver and all that, it's just there, it's happening. But before you know what's happening, it has gone to the lungs, it has gone to the brain. So you begin to have little seedlings, because the plan of that cancer is to take over. Then you have little seedlings of it in every other part of the body, in the bones, in other areas. So you have these things, you can have easy spread of them. So I think I would end it there, but they're preventable things. Prostate cancer is treatable if it is detected early. You could have a PSA. And when Dr. Adebayo was talking, one of the things, you don't even necessarily need to see a doctor, because what many people think, the thing that we have on people's mind is you feel, oh, every time, does it mean I have to go to the doctor? You don't have to get to the doctor. Walk into any lab. You can request on your own that I want to have a PSA done as a man. Are we okay? As a woman, you can request, I want to have a mammogram done. As a woman, you can request, I want to have cervical cancer test. You don't need to go and see a doctor. The only place you may need a doctor is after you have received the result. Let them be able to tell you what is there. But you don't have to say, let them write it for me. Nobody needs to write it for you. Walk into the place yourself, anywhere. As long as tests have been done there, they will do the test for you. Hello? Praise the Lord. So we can take questions. Okay, I have one question here. How do we trust the integrity of the doctor? I think I already answered that. Don't worry, you don't need the doctor. You, of yourself, the place that you trust, walk into any place. This is what I want to get done. Are we okay? So it has nothing to do with the doctor is right of your own. You're the person that wants to do the test. So it has nothing to do with the integrity of the doctor. I don't know whether you get what I'm trying to say. That is one. On the other hand, now you have had your tests done, but probably to interpret it may be a problem. But just like the Bible says, in the mouth of 2 or 3 witnesses, you have every word established. If you have something, I've only decided to show it to this, my doctor. I can always have another opinion. I don't know whether you get what I'm trying to say. So irrespective of what one doctor has told you, you have your result. That result is your own result. You can take it to somebody else and let them interpret what is there. So this is not so much about the doctor. It is so much about you. Hello? Okay, thank you. Okay, thank you very much. God bless you.
The last question, no other.
Okay, can prostate cancer cause erectile dysfunction? Yes, it can cause erectile dysfunction. As a matter of fact, for a person that has prostate cancer, I didn't want to start listing all the signs. There is something we call, even in medical school, they're having you train. So as a medical student, if your lecturer comes into class and they take you a topic, most times you would always feel, oh, maybe I have a problem. I don't know whether you get what I'm saying. Because by the time I list everything, by the time everybody is going home here, you will think you have a problem. I don't know whether what I'm saying is clear. And as Dr. Adebayo was saying, one of the things she said, breast lump. And I remember my sister calling me, my older sister now. She said, please, Yinka, one of my friends, she needs to come and see you. She said she has a breast lump. Lo and behold, at that time I was even on leave. But I fixed an appointment with her and I came to the hospital just to see her. Seeing her, I examined her. She didn't have any breast lump. So I need to emphasize here, every woman, your breast tissue, that breast is a tissue on its own. You feel it, it comes as a lump. Hello? So the lump of breast cancer is a separate lump. I don't know whether the breast tissue on its own is a lump. I didn't see anything on the woman. It was just the breast tissue she was saying. I wondered how. I was not asking her. Although at that time, she was getting perimenopausal. I think she was about 52 or 53, one of the two. I now asked her that, Madam, how come you are complaining you have breast lump? But has your breast not always been like this? She said, that she never noticed. And that's one of the things that get familiar with your breast. That's all. Because the breast tissue on its own is like a lump. But it's just that lump, that one is a whole lump. It's just one whole thing. But once you begin to feel anything separate, that is what we categorize as a lump. I don't know whether what I'm saying is clear. So I didn't want to have to be listing everything, because by the time you hear everything, every man going there, when they get home, they will think they have a problem. Or by the time we have talked, they will say, I have problem, but you do not have a problem. So really, prostate cancer can cause erectile dysfunction. So for somebody, that may be the first sign that you are knowing. You need to check up those things to know what it is, but it can actually cause erectile dysfunction. What relationship does it have with our sexual life? What are the immediate remedy? Okay, so if we're talking about prostate cancer causing erectile dysfunction, definitely that's going to affect sexual activity and all of that. But the truth is, I'm sure if a man has an erectile dysfunction, initially it may not take so much of it, but if this becomes a persistent issue, you would want to look further, as in what is actually the cause of this. And I'm sure by the time they are telling you that this is the outcome, this is what a person has, the issue is you have something more serious on your hand. At that point in time, you are not thinking about sexual activity. You are thinking about to get treatment. I don't know whether you get what I'm trying to say. For a woman that has breast cancer and she's been told you have breast cancer, that's not when she'll be saying that, my breast is drooping. That's not the next concern. I don't know whether you get what I'm trying to say. There are more serious issues on your hands than for you to be talking about such things. But really, because this could actually cause erectile dysfunction, so it could affect a person's sexual life. But immediate remedy is that prostate cancer is treatable. There are things that can be treated. So I'm sure once a person gets treatment, all of that can be dealt with. Praise the Lord. Okay, thank you very much.
Praise the Lord. I'm sure we have been empowered. And I believe that some of us will follow up. Praise the Lord. Dr. Adebayo will still be with us till the end of the service. So if you'd like to ask maybe private question, you'd like to see her on a one-on-one basis, she will still be available. Praise the Lord. Is that okay? Praise the Lord. Our PICP is around. Can we have the two doctors so that we'll pray? Mommy, pray with them. Dr. Adebayo, Dr. Goodman.
Praise the Lord. I just told Dr. Goodman to quickly distinguish between two things that may be worrisome to the men, so that your hearts are at rest. There's prostate enlargement and prostate cancer. So you may have prostate enlargement, which will be managed by urology. So I'd like you to just talk about that, and then we'll pray.
Okay, to also mention, just like I said, I don't want to scare us, because every time you hear something, and for us in medicine, every time you would always hear risk factor, risk factor. The truth is, who is it that does not have risk? All of us, we have risk. No, I'm telling you the truth now, because by the time they will say, do you have risk of family history? Tell me in whose family they don't have cancer. I don't know whether you get what I'm trying to say. They will say, by the time you look at it, everybody has, but there is no point putting fear into all of us, so we can't keep talking about so many things. So if a person, like I said, you would usually have a lot of those symptoms I've described if a person has prostate cancer. But all of these symptoms, so if you have any of the symptoms, you can go to the hospital. But by the time you get to the hospital and a person is examined, they may be able to tell you, and you have gone through some tests, whether what you have is actually cancer or not. Because the truth is, with anything getting swollen there, any swelling you have there is going to present. That was why I started talking about the pressure symptoms if you have any swelling. So, if a person, so most of the time, even with ordinary prostatitis, with just inflammation a little infection in that place, you could have some of these symptoms that I listed. But it is also possible that what a person has is just what we call BPH. That's just prostate enlargement, prostate hypertrophy. And for most men, as they grow older, they could have that hypertrophy. But the difference is, which means it's also swollen. You now, it's the doctors that will be able to tell, oh, what this person has. Is it just, this is just a gentle enlargement, or this is cancerous? But most of the time, they will present with the same symptoms. Are we okay? So that's what you'll get. But when you get, if the doctors examine, they will be able to tell you, oh, this is just a benign, this is not cancerous. But really, the diagnostic thing for the two of them, whether it's prostate enlargement or the prostate cancer, is when you do a PSA. Because when you do a PSA, in enlargement, whatever figure you're going to be getting is going to be within normal figures. But in prostate cancer, you will see it will go. When you say, okay, just scale, oh my, pata pata, you know, that kind of a thing. Because usually you will have that reading between 1 to 5, thereabouts, normally. But depending in older persons, till age 70, thereabouts, it may get slightly increased. It may get up to 6. We may be able to take it up to 6.5. But in prostate cancer, you will see 200. So you get the kind of thing now. Once you see it, you'll be seeing 100. Not like you'll be seeing all these single digits. It won't be single digits. You'll be seeing 90, 80, that kind of a thing. That figure would have been so high. But really, the two of them are enlargements. But now the difference is which one is cancerous and which one is not cancerous. Though when we doctors examine, you would be able to tell. Looking at it, feeling it. Because these are things that clinically you come, we examine through the rectum. We can say, because there are ways certain cancers, they look. Cancers, they're likely to be hard when you feel it. But ordinary enlargement is not likely to be hard. You just know that this is just a mild swelling. But when you go for the test, that's the diagnostic thing that we will be able to tell whether or not this is cancerous. And for most of us, don't let us feel too somehow about a lot of these things. You know, just like I said, oh, maybe you want to have somebody examine the breast and you are still feeling shy. I remembered once when my mom went to the hospital and she had a surgery. And you know, my dad, I stayed with her for a while. And when my dad came to the ward, my dad kept saying, somebody that's just finished going through surgery, you're in pains, you're in all that. Oh, bearing heat here, my mom said, Idi, kill fi the hospital, I'm Edi. And it's the truth now. My mom said, I'm Edi, you will see tire. That's the truth. So all those things we feel like, you know, at times, I just know the way people feel. There's also another man, like an elder in my parents' church. So, and really, at the end of the day, it was diagnosed that that man actually had cancer of the prostate. But before this man knew, he started having those pressure symptoms. And the man now told my parents. And when he told them, he said, since your daughter is a doctor, maybe she will examine. My mom said, kiwalode. I'm like, which one is Who looks at all of that? No, nobody looks at it. Nobody is praying for trouble.